Yes, now we can start.
Good evening, everyone present over here, respected Gaurav Soni sir, seniors, and my dear batchmate. This is our ninth session of Ayur Journal Club, where we'll be discussing another new article. So, in the face of rising global hypertension rate, what if one of the most effective non-pharmacological tool for long-term BP control was not a new device, but an ancient fingertip therapy? Today, I, Sakshi Singh, along with my fellow batchmate Avinash Kumar Chauhan, will be discussing a case report titled as Blood Pressure Normalizing Effect of Talahridaya Marma Therapy. It is suggesting that the precise stimulation of Talahridaya Marma point can achieve a significant and sustained normalization of blood pressure. The author of this article is Anurag Singh Gautam, Piyush Verma, Ashutosh Kumar Pathak from the Department of Rachana Sharir, Faculty of Ayurveda, IMS BHU. So let's get started with the abstract. The author first mentioned the basic points of marma as ancient Ayurvedic literature described in ancient Ayurvedic literature. There has been description of 107 vital reasons of the body and considered them as a seat of prana, collectively termed as marma. The applied aspect of this concept, marma chikitsa or marma therapy, is gaining popularity as being practiced by many clinicians. Hypertension is one of the major disorder affecting majority of the world population. Moving on, the objective of this particular article is to explore whether controlled stimulation of Talahridaya marma can be effective as non-pharmacological adjunction or not. When we see the methodology, here the author taken a case report of a young hypertensive male whose blood pressure significantly improved with Talahridaya Marma Therapy. The patient was detected with raised blood pressure on repetitive examination, and this detection was accidental or sudden. The volunteer was subjected to the therapy where his marm point on the left upper limb was physically stimulated in controlled way for 10 days, and the patient was also taught to perform the therapy on himself. The result came out to be the blood pressure was recorded both before and after giving the therapy on each day, and volunteer showed significant improvement in his blood pressure recordings. Okay, now introduction of marma. We'll first start with the definition of marma given in Shushrut Samhita, Sharir Sthan, chapter number 6. Marmani mans sirasnayava asti sandhi sannipatah teshu swabhavata eva visheshen pranishtanti, which means marma regions are the confluence of mams, sira, snayu, asti, and sandhi, and these are the pranayatans where pran resides swabhavata. Marma are the vital point of body described in Ayurveda that when injured may lead to pain, disability, or even death, depending upon the type of marma involved. There are 107 marma points in the body which have been elaborately described in Shushrut Samhita in Sharir Sthan chapter number 6. The classification of marma are done on three bases. First is regional classification on the basis of Shadanga Sharir, the structural classification as Mams, Sira, Snayu, Asti, Sandhi, and Vagbhat added one more, which is Dhamani. Another is prognostic classification, where Sadhya Pranhar, Kalantar Pranhar, Vaishalyagna, Vaikalyakara, and Rujikara Marma comes. Moving on, it is advised that these sites are the sites of body which must be protected from any physical injury or trauma. We can mention here as Raj Nigantu quoted Marma as Jeevasthanam, and Dalhan, who is commentator of Shushrut Samhita, mentioned Maryanti iti marmanya uchyate, which means marma injury can cause death. Acharya Shushrut indirectly utilized these marma reason for the treatment of many diseases through Sira Vaidya near the marma. Now, introduction of hypertension. Hypertension is a condition where the force of blood against arterial wall is consistently elevated with a diagnosis based on reading of 140 by 90 mm of Hg or higher on two or more consecutive readings. It is one of the major disorder affecting majority, not only the older age group, but also the adults. Moving on the objective of this article, it is a case of young hypertensive male whose blood pressure improved with Talahridaya Marma Therapy. Observing his daily pre and post therapy blood pressure measurement over 10 days and observing the trend over these 10 days, although the clinical significance of the therapy is sparse, here author is trying to see if controlled stimulation done of Talahridaya Marma is effective or not. We'll see the patient profile. We can see he is a 23-year-old male patient of he's a BMS student in IMS BHU. He don't have any prior medical or surgical history. He's a non-smoker and non-alcoholic. He does not have any family history of hypertension or any inflammatory diseases. The patient has well-built physique with height of 171 centimeter and weight 71 kg. Initial finding of his BP, which was accidental, was 174 by 100 mm of Hg, and after multiple readings, which was 3 times after 10 minutes of interval, averaged to be 171 upon 97 mm of Hg. He was clinically asymptomatic and unaware of his high blood pressure. To rule out any inflammatory causes, the CRP test, which is C-reactive protein test, was done, which came out to be negative. Now, the anatomy of Talahridaya Marma. As we have already mentioned in previous slide, that Talahridaya Marma comes under the regional classification, and it is a Shakhagat Marma. Two, there are four Talahridaya Marma present in body. Two is Bahugat, two is Saktigat. Here, author has also mentioned that it occur in upper limb, palmar region, and lower limb, sole. In upper limb, it lies in the middle finger, in the line of middle finger, in depressed area above thenar eminence. On flexing the middle finger, the depressed spot where finger meets palm is taken as marm point. Classical texts warn that trauma to this marma can be harmful, but controlled stimulation is used therapeutically in marm chikitsa. As we can see, cardiovascular system like hyper and hypotension, palpitation, and various central nervous system diseases like hysteria, epilepsy disorder can be improved with Talahridaya Marma therapy. This was my part. For further discussion, I would like to call Avinash. Thank you.
Good morning to my respected teacher, mentor Dr. Gaurav Soni sir, and my respected seniors, and warm welcome to my batchmates who are here for a discussion on a case study about MRM therapy. So the heading of our discussion today is the blood pressure normalizing effect of Talahridaya Marma Therapy, which was done itself on a student who is pursuing BMS at BHU Varanasi. So I'm commencing with Shalya Vishard Shalya Vishad Vishad Mud sorry. So I'm commencing with Shalya Vishyadharma Udaharanti. This quote attributed to Acharya Shushrut, the ancient Indian surgeon considered as the father of surgery in Ayurveda. He placed the knowledge of marm point at the absolute core of surgical practices, which signifies the importance of marm point and their knowledge. He stated that the knowledge of marm point is itself the half of the knowledge of Shalya Tantra. So what does it mean? In a essence, a surgeon is judged not just by what they cut, but by what they successfully avoid cutting. The ability to navigate the body without causing any fatal harm by respecting the merm point is what constitutes the half of the surgical skills, marking its study paramount. So these points also form the basis of treatment. This paper discusses about the Talahridaya Marm. So as of now, we have discussed about the location, function, and how its better and precise manipulation of this Marm can have beneficial effect on blood pressure. So I will be elaborating the methodology involved in it. After informed consent, the Talahridaya Marm on the left hand was physically stimulated once daily for 10 days by the doctor, synchronized with the volunteer breathing uh, for uh, for 3 minute of sessions. Pre and post therapy BP readings were taken. The volunteer was also instructed for self administer the MERM stimulation with the thumb of opposite hand twice daily after training. Now, coming to the observations he got in 10 days of the BP readings, pre and post therapy. The readings were the both for systolic and diastolic blood pressure. On the very first day, the blood pressure reading before the therapy was 171 by 97. After the therapy, the reading falls to 162 to 102. On the second day, the reading was 152 by 98 before the therapy and 141 by 89 after the therapy. And on the fifth day, it was 144 by 86 before the therapy and 136 by 83 after the therapy. And on the final day, it was reduced to 133 by 79 before the therapy and 120 by 72, which is quite normal after the therapy. So the key findings were on the very first day after the therapy, the systolic BP drops by 9 mm of Hg, but the diastolic blood pressure rise shows a transient or a temporary rise of 5 mm of Hg. The subsequent days shows the progressive reduction in the both systolic and diastolic blood pressure. And the patient continued the self therapy and maintained the normal blood pressure beyond 10 days. Uh, Now, coming to the discussion, which includes the treatment protocol. According to Ayurveda, the stimulation of marma points modulate the pranas, which in turn can influence doshas, nadis, and systemic homeostasis. Controlled stimulation of these points have beneficial or positive therapeutic effects. During the first day of the therapy, the patient felt slight bearable pain on the marm area and he was overcautious while going through the therapy. And on the first day, there was reduction in systolic blood pressure, but the diastolic blood pressure was raised after the therapy. However, on the second day, the pre-therapy, the blood pressure was lower than the previous day, which motivated the researcher to continue the therapy. The gradual reduction in the pre and post therapy of the blood pressure suggests a possible long-term regulatory effect, not just a transient lowering. The volunteer is still practicing self-Talahridaya Marma Therapy and his blood pressure is within normal range till the day of reporting this case report. Now coming to a very important part, the patient's perspective. He was initially shocked by knowing his blood pressure was high and it was on an accident because as it was an accidental discovery. So about knowing the Marm therapy, which he studied in first year, class, he was curious and eagerly wanted to try it. According to him, the therapy was comfortable and he just felt a bearable pain at the MERM area after the first therapy session. He was surprised with the lowering of his blood pressure after the first session, so he was motivated for further sessions. And now coming to the end of the perspective, he was more than happy about his blood pressure, which came to a normal range, and felt satisfied about this therapy. Now we'll talk about the strength and limitations of this case report. The positive part of this case report was that it was easy to learn and can be self-administratable and also follow the daily monitoring, daily detailed monitoring. And now talking about the limitations of this case report, only single subject was used, no randomization or comparison, which can give a broad scale effect on a population level of studies. It was only done for 10 days, which is a very short period of time. And it have a precaution that overstimulation of these MERM points can have adverse effect as per Acharya Shushruta. So it should be done or practiced in a guidance of any medical expert. Now coming to implications. What are the implications we can draw? The case report suggests a potential talahridaya therapy as an alternate and a non-pharmacological option in hypertension, and to encourage a large clinical trial on enough number of people. Another implications are author mentioned the therapy may prove beneficial in diabetes mellitus, thyroid dysfunction, endocrinal imbalance, but there is no documental evidences, so we can look at it as a scope of research. We have discussed this case report, and conclusion which we can draw from it are Talahridaya Marma Therapy was found to have mild immediate effect and a good long-term effect on normalization of BP of the patient. The therapy was given daily for 10 days and it shows the significant improvement in both systolic and diastolic blood pressure. Thus, a future large-scale study is needed to analyze the blood pressure normalizing effect of Talahridaya Marma Therapy. These were the references which was taken by the authors for publishing this case report and its credibility. Now, our respected Dr. Gaurav sir will give a detailings of this paper and elaborate this report with his expertise to all of us. Thank you.
So first of all, I will say, being a first year student, you both have done a tremendous job and you have given a very nice presentation. So this will be the thing which we wanted, that our students should themselves give everything. And you have also included implications and limitations also, which are not actually the part of paper. So that's the best part. Means अपना काम अच्छा चल रहा है, वो अच्छा लगा मुझको. ठीक है, very good. So most of the thing तो आपने खुद ही
Thank
बता
you,
दिया
sir.
है. पहले हम क्वेश्चन आंसर भी कर लेते हैं. Do the question answer also. Okay, Avinash?
Sakshi will continue. Yes, sir. Sakshi will continue for the question.
So this time there are some question answers. You can keep in your mind question answers. If you want, you can give the answer. Otherwise, you will complete it because this session is for 40 minutes. I will start with new session. Okay. तो पहले question answer कर लेते हैं.
Okay, the first question is, according to the case report, what was the immediate physiological response upon initial stimulation of Talahridaya Marma point? Option A, a significant drop in both systolic and diastolic blood pressure. Option B, an increase in systolic blood pressure but drop in diastolic blood pressure. Option C, a drop in systolic blood pressure but a transient rise in diastolic blood pressure. Option D, an immediate increase in both systolic and diastolic blood pressure.
Option C.
Yes, option C is correct. A drop in systolic blood pressure but a transient rise in diastolic blood pressure.
Now, next question.
Next.
As noted by Shushrut, why is the overstimulation of any marm point including Talahridaya discouraged in marma chikitsa? The first option is it may reduce the doshas too excessively. Option second is it can disturb the pran and cause functional damage. Option C, it blocks the nadis and stagnates the blood flow. Option D, it's lead to hypertrophic muscle contraction.
Option B.
Yes, sir, correct.
बादल के अलावा कोई और सुनता नहीं है क्या? क्यों बादल?
जी सर.
कोई और नहीं बोल रहे हैं कुछ? इस बार तुम लास्ट में बोलना, ठीक है? पहले दूसरे को देखते हैं कोई बोलता है कि नहीं. ओके,
जी सर.
ओके, चलो नेक्स्ट.
Okay, next question. As per the described therapy protocol, stimulation of marma point was precisely synchronized with which physiological parameter of the patient? Option A, heart rate variation. Option B, respiration rhythm of the patient. Option C, pulse rate of the radial artery. Option D, eye blinking frequency.
Option B, respiration rhythm of the patient.
Yes, option B is right answer.
Like this. You have to give other person, na? Now next one. Absis का भी chance खत्म. चलो next.
The next question. The long-term normalization of blood pressure reported in a case study was attributed to which of the following mechanism? Option A, continuous nerve sedation at murmur site. Option B, regulatory modulation of pran influencing the dose balance. Option C, reduction of cardiac output through reflex inhibition. And option D, a simple placebo effect resulting from the patient self-practice.
No one. ध्रुवी, फाइनल वालों का रिवीजन कराते हैं। ध्रुवी,
ऑप्शन बी।
बताओ आंसर।
Yes, sir. Correct answer.
हो गया करेक्ट?
Yes.
नेक्स्ट नेक्स्ट, चलो अच्छा नेक्स्ट।
Next question. Based on Shushrut classification, Marma points like Talahridaya are considered vulnerable because they are essentially represent which of the following? Reason of nerve ending only. Option B, junction of Mams, Sira, Snayu, Asthi and Sandhi. Option C, points overlapping major endocrine gland. And option D, area purely muscular without vascular significance.
Option B. Option B.
Option B is the right answer.
ओके, वेरी गुड। अभी कितना टाइम बचा है अविनाश?
सर अभी देखना पड़ेगा। सर यहाँ तो नहीं दिखा रहा है, बट
नहीं
इट विल
दिखा
एंड
रहा
इन
है, ठीक
40
है।
minutes.
हाँ, दैट्स वाई 40 मिनट्स था ना। आई थिंक 34 मिनट्स तो वी हैव ऑलरेडी यूज्ड। तो आप ऐसा करो, पहले रिकॉर्डिंग बंद करो। बंद किया?
एक सेकंड।